Доброго дня, дорогі колеги, шановні учасники. Я дуже вдячний професор Григорівні за запрошення і дорога Наталія Вікторівна, щиро сердечно дякую, що в цій тяжкій ситуації ти вирішила зорганізувати такий прекрасний симпозій і конференцію. Ми тут в Польщі не забуваємо про вас і не забудемо. Це я декларую і бажаю вам миру і всього найкращого. І маю надію, що це так ще буде продовжатися, що це направиться, що все так як ми думаємо по нашій думці. Дуже дякую. Слава Україні! І тепер дозволіть, будь ласка, що я перейду на англійську мову. Хочу сказати про рідкі причини остеопорозу. Rare causes of osteoporosis. Well, this is a neglected topic, and just there are two different scenarios or two aspects of the disease. Osteoporosis could be associated with other specific rare disease as a secondary problem. In other words, it could coexist with the rare condition. Whereas sometimes, on the other hand, osteoporosis might be caused by another unusual etiology. Anyway, the rare etiology remains unclear, and it's usually underestimated or poorly diagnosed, might be named idiopathic or atypical, and remains certainly beyond the mainstream, like postmenopausal osteoporosis or age-related osteoporosis. Well, it's not age-related, although most cases have been detected in infants, children, in young adults, or men or women before menopause. When you raise the question, is this primary or secondary osteoporosis? Those rare cases of osteoporosis are usually primary one. So the original lesion or original primary initial origin is complicated, might be associated with the inborn defect. Anyway, there are several diseases, rare diseases or ultra rare diseases that produce bone damage or deterioration of bone quality and strength. A typical osteoporosis might appear in a number of genetic disorders or inborn error of metabolism. Those diseases might be lifelong conditions. Please keep in mind, these, although most of them are birth related, so congenital, they might also become manifest at each age, or just they might become clinically apparent in adulthood. Up to 30% are such a strange, awkward symptomatology. Some landmark diseases, including osteogenesis imperfecta, dentinogenesis imperfecta, hypophosphatemic rickets, or hypophosphatasia, or juvenile Paget, are still considered rare diseases, not as much as Ehlers-Danlos or joint laxity and hypermobility syndromes. And those diseases might be easy to detect and to diagnose using some basic technical and methodological set. Severe multiple fractures, deformities in the skeleton, blue sclera or dental abnormalities might suggest such a disease. And what's important, there is no homogeneous stratification of rare osteoporosis. These diseases represent multidisciplinary approach, and as they are heterogenetic, I mean, they represent the heterogeneous nature of rare causes. So it's a mosaic. It's rather a spectrum of diseases than one group of diseases. Therefore, attempts to classify or to organize the rare causes of osteoporosis are not much useful in the everyday practice. And case series or case reports are very supportive to understand and to improve our thinking and our diagnostic skills. In my opinion, there are three conditions or circumstances that could be overlooked. We health professionals might miss those rare osteoporosis due to the following reasons. First, very low frequency, sporadic incidence. We might only see occasionally some of these diseases, or even we might not have opportunity to see them, never ever. A less evident clinical manifestation, so the insidious course is a typical thing until the first fracture occurs, first fragility event. And finally, our knowledge is limited and our awareness is insufficient. I mean, the health community. There is a large list of frequent causes of rare osteoporosis, secondary osteoporosis in the majority of cases, like endocrine, diabetes, hypothyroidism, Cushing, or acromegaly, or primary hyperthyroidism. They are still rare, but not as rare as we think. The second group is primary disorders of collagen synthesis and collagen metabolism, genetic inborn syndromes. Those include several types of osteogenesis imperfecta, and the phenotype with the fragility. We have more than 17 types of osteogenesis imperfecta. Many of them could be missed or overlooked. Drug-induced osteoporosis and glucocorticosteroids and anti-epileptic treatment, and also perhaps chemotherapy and irradiation, so oncology is the landmark group of drugs inducing or increasing the risk of osteoporosis. And finally, other causes like immobilization, bed rest syndrome, several myopathies, dystrophies, and rare neurologic conditions, but also multiple sclerosis, rheumatology and spondyloarthropathies, and myeloma multiplex, chronic obstructive pulmonary disease, and cystic fibrosis, obviously. But there are also a rare list, even rare among those rare causes. What I mean is just endocrine disorder, which is hypophosphatasia, congenital one, characterized by low alkaline phosphatase, usually neglected, lower reference, porphyria Noonan syndrome, and a rare but still existing pregnancy-associated osteoporosis with fractures and lumbar spine lesions. Primary disorders of collagen synthesis. This is not only osteogenesis imperfecta, but also metabolic diseases including Ehlers-Danlos spectrum disorder, homocystinuria, Marfan-Brugg osteoporosis, pseudoglioma syndrome, juvenile Paget, copper metabolism disorders like Wilson disease and Menkes disease, Hyduceni cutis laxa Rett syndrome, and several types of hypophosphatemic vitamin D resistant rickets. When you look at the drugs, the list is pretty long, but the awareness is very limited regarding proton pump inhibitors that are largely used in adulthood, but not only in pediatric populations as well. Proton pump inhibitors like omeprazole, gastric bypass, aromatase inhibitors, anticoagulation treatment, and also psychiatry, lithium and SSRI might produce a very, very unfavorable effect on the skeleton. And the group others is also quite rich and Interesting. The rare diseases might still happen to you in your clinical practice. Lysosomal storage disease, including mm, mucopolysaccharidosis, or mastocytosis, or proximal tubular acidosis, including Fanconi syndrome. These are rare conditions, but still very, very important for bones. Whereas bone is not the priority symptom, the skeletal disorder. Major depressive disorder or depression in general is also a risk factor of osteoporosis. Of course, it's age independent. It might happen to in all ages, but if it's a cumulative etiology, depression plus other geriatric conditions, these might be very deleterious to bones. Definition of the diagnosis of osteoporosis is well known. It's just low BMD, fractures, and deteriorated bone architecture, decreased bone quality. When you are obliged to routinely assess bone and mineral metabolism or to perform X-ray of some parts of the skeleton, whereas the diagnosis of rare and atypical osteoporosis is not as easy. To explain the primary osteoporosis and rare causes, we sometimes need a more advanced techniques and more sophisticated diagnostic methods like bone biopsy and histopathology, high-resolution peripheral computed tomography, which is not routinely used, but it's very, very excellent for the examination of trabeculae, the thickness and the cortical bone, etc., etc. And finally, NGS, next generation sequencing, which is the molecular examination of the new mutation, which may help to diagnose, but not necessarily may help to treat the patients. The definition is clear, but please be careful with the low BMD, because the decreased areal bone mineral density in different skeletal regions might be congenital, just might be determined and could be considered natural feature, and is not just a disease but is specific for a given individual. So low BMD is common. However, when there is no history of fractures, it doesn't necessarily mean osteoporosis. Nevertheless, we need to focus on total body, bone mineral content and density. It's always helpful in rare cases. Not only the DEXA for spine, hip or forearm, but also total body LASCAT option is necessary. You looking at the bone, you could see the micron, nano scale in the bones. So X-ray, DEXA, peripheral computed tomography is for micro and nano level, means bone turnover markers, bone biopsies, molecular examinations. For atypical osteoporosis, trabecular bone formation is important, and attention, there is usually mineralization disorder or deteriorated osteoblast function. So it's a dysfunction of osteoblasts. For atypical osteoporosis and fragility, first of all, sort out secondary osteoporosis. Exclude the secondary osteoporosis. Even official guidelines issued by IOF are producing some confusion, because if you look at this point, the evidence is very scarce and there is no clear definition of osteoporosis, nor intervention threshold in younger individuals. True osteoporosis in the young can occur, which we define as a T-score below 2.5 at spine or hip in association with chronic disease known to affect bone metabolism. Fragility fractures of unknown origin, imagine a scenario like that. A man or a young man with one fracture, so it's a plaster management by the orthopedic surgeon. What happens next? Another and another one. 3 further consecutive fractures, and the 3 plasters and orthopedic surgeons. The question arises, did the orthopedic surgeon consider rare causes of fragility and osteoporosis? A few examples: stress fractures in the young athletes or recruits, complicated by avascular necrosis of the femoral head; pregnancy-associated osteoporosis, not rare and still exists, could be misdiagnosed; primary deficits of trabecular bone in young men. It's an elegant study proving there is a problem which is independent of the aerial BMD, so DEXA scan doesn't help here. Or another paper suggesting undermineralization of bone matrix as a problem producing disorder of the low energy fragility. And this might be not necessarily associated with the resorption, but osteoblastic dysfunction. And this is our study: High-Duchenne syndrome, acroosteolysis and skeletal defects plus osteoporosis. A very educational case, because I myself performed the DEXA scan back in the 1995, and the conclusive diagnosis was, ultimate diagnosis has been established 15 years later or more. Osteoporosis of rare origin: when to suspect, when should we think about? Unexplained low BMD in children, adolescents, young adults, particularly an extremely low BMD like less than -3.0. Unexplained cause of low energy fractures of long bones. Multiple repeated clinically significant fractures. Vertebral fractures using radiographs, and atypical phenotype, disproportional body stature, disproportional facial dysmorphism, delayed puberty, joint laxity, abnormal dentition, ectopia lentis, and many others. Further, radiographs, abnormal X-ray imaging, scarce or attenuated bone tissue, periarticular osteoporosis, skeletal dysplasias, dyschondroplasia, conical enlargement of the epiphysis of long bones, limb deformities, rickets, fibrous dysplasia of the bone, Wormian bones in the skull like in the osteogenesis imperfecta, or history of old fractures in the radiographs. And finally, abnormal laboratory tests found accidentally: low ALP, increased PTH, low platelets like in Gaucher disease, hypercalciuria, high increased cortisol secretion, and last but not least, family history of abnormal DEXA results. Significantly decreased BMD in first-degree relatives. And high-risk families also include family history towards skeletal fragility, skeletal dysplasias, and recurrent fragility in particular. To summarize, no consistent guidelines regarding treatment of the rare osteoporosis exist, so the case reports only are helpful, lacking recommendations for the management of those younger than 45 years. FRAX doesn't apply to younger populations and for those with unusual osteoporosis. And the implementation of the official recommendations into clinical practice is difficult in the procedures addressing rare osteoporosis. To conclude, children, young adults, premenopausal women with evident or potential clinical risk factors should be first screened for secondary osteoporosis. Otherwise, it's a long-lasting, elaborate and laborious way to determine the cause and characteristics of atypical osteoporosis. Wishing you all the best and thank you. Всього найкращого.